This video was created by the Medicare Rights Center, a national nonprofit organization that works to ensure access to affordable healthcare for older adults and people with disabilities. In this video, you'll learn about plans for people with both Medicare and Medicaid. Over 12.5 million people are eligible for both Medicare and Medicaid. They're called dually eligible individuals, or sometimes duals for short. Dually eligible people have lower incomes, experience disproportionate health challenges, and account for relatively large portions of program expenditures. Dually eligible individuals have diverse needs and circumstances, but nearly all face challenges navigating their coverage. Being enrolled in Medicare and Medicaid can mean working with two distinct sets of benefits, rules, processes, and providers that don't often overlap. This lack of coordination can burden enrollees, providers, and the programs, driving up costs, administrative challenges, and worsening outcomes. This is where D-SNPs come in. D-SNP stands for Dual Eligible Special Needs Plans, and are Medicare Advantage plans that provide specialized benefits for those who are dually eligible. At their most integrated, D-SNPs can provide coverage for the full suite of Medicare and Medicaid services seamlessly, allowing enrollees to interact with only one plan and one set of rules. D-SNPs are required to establish a model of care, which can include interdisciplinary care teams and care coordination across different providers. But how do D-SNPs play out in reality? In Medicare rights experience, people are often unaware that they are even enrolled in a D-SNP. This likely indicates that enrollees are making suboptimal coverage choices, and that plan designs and governing regulations are under-delivering on promised integration. For instance, most D-SNPs' only integration of benefits is that they notify the state when an enrollee is hospitalized. And despite the promise of care management, many D-SNP enrollees don't see additional support or experience better communication between their Medicare and Medicaid providers. Without change, the disconnect between the two programs' provider networks will continue to leave gaps in communication and access for many enrollees. The current landscape, where people with the highest needs have the fewest resources and the biggest hurdles to overcome, is unsustainable. Although the promise and the reality of D-SNPs diverge, opportunities to improve the system persist, including by better integrating Medicare and Medicaid for people enrolled in both programs. This video was created by the Medicare Rights Center with support from Arnold Ventures.